All right, still to come, a light-changing procedure that could save your infant's sight.
Yeah, 2 to 3% of babies are born cross-eyed, but they don't have to live the rest of their lives that way. A procedure, when done at the right time, can help cure it.
Your baby is born and it's a wonderful moment, and then you notice their eyes seem crossed. It's a condition called strabismus. A Hawaii doctor can fix it, but he urges it needs to be done early. 2 to 3% of children are born with strabismus. That's the term for cross-eyed. It is treatable. The question is what to do and when to do it.
A lot of children are mistaken to be cross-eyed at young age. So we have to do some muscle testing, some real testing to see if they're really out of line.
Ophthalmologist Dr. Malcolm Ng knows all the tricks to gain an infant or toddler's attention to study their eyes. If their eyes are crossed, he's the go-to doctor. In the past 40 years, he's performed close to 6,000 surgeries to correct crossed eyes. He says it's much more than just cosmetic surgery. It helps a person form binocular vision and depth perception, which he says is extremely important in life.
It's important in sports. It's important in function and doing things that you want to do as far as an activity or a profession.
Imagine not being able to tell how far away that ball is when you're up to bat, or with a baby, not knowing where to place those hands and feet to crawl. Today, it's checkup time for Cassidy Murakami, a healthy, active 15-year-old. But when she was just a few months old, her mother noticed her eyes were crossed and she was reluctant to crawl. Dr. Ng performed the surgery on Cassidy. It's an outpatient procedure where he cuts the muscle in the eye.
And remove it and put it further back. It's called a recession. And that's the one kind of recession you want. And what you do is you put it back further on the globe so it has less pull.
Sometimes it takes more than one operation, but take a look at Cassidy's before and after. Mom Michelle noticed the difference right away.
After each operation, she got better and better and better, where she was able to move and not be so shy of moving around.
Cassidy doesn't remember being cross-eyed, but says she's glad they did the surgery.
I think it benefited me because otherwise I wouldn't be able to see really well. Like now I can see, I can go to 3D movies, I can enjoy my life.
You know, and because this is not just a cosmetic surgery, but something really necessary, this operation is covered by insurance. But again, Dr. Ng says it's best to be performed before the child turns 2.
And again, yeah, it can change the quality of life so
definitely.
quickly.
Yeah.
Great story.